Hi, good evening everyone. This is Sunita. Welcome to my presentation. And again, I am back to explain the important topic, that is perseveration. And here, the perseveration, you can see this is one of the symptom, or we can also say that abnormal form of thought. And mainly, we can see this symptom in the people who has the psychiatric disorder, that is a depression. And here, we can see the exact meaning of this perseveration. Persistently repeating the same word or idea in response to different question is termed as perseveration. Persistent repetition of words or particular response. The repetition of particular response, such as word, phrase, or gestures, regardless of the absence or cessation of stimulus. Okay, so these are the definitions of this perseveration. So exactly how we can find this symptom in person? See, if the person saying his words or phrases or gestures again and again to you, to different questions, so that we can call the perseveration. If the person saying his words or phrases or gestures again and again for different questions from you, so that you can call perseveration. Okay, and so later we can see the example. First, you see, in number of conditions we can find this perseveration symptom, like we can see in aphasia, brain injury, Alzheimer's, schizophrenia, Parkinson's disease, stress, the people who has the stress and anxiety or depression. So among these all the people in, we can see this perseveration symptom. Okay, and not only that, is there any damage to the frontal cortex also, that persons also have this perseveration symptom. Okay, example. Okay, here you can see the example. Here the conversation is going between mental health nursing officer and depressed client. Here just look at this example. Here nursing officer greeted patient good morning, and the client given response that good morning. Okay, now what you are thinking? Is this normal conversation? Yes, this is normal conversation between every doctor and patient, or every nurse and patient. Okay, so next example you can see, you can get clarity about this symptom perseveration, right? Okay, see next example, the second question. So this is the second question from the nursing officer. Here the nursing officer asked that, do you say your name? As a normal client, he should give the response with his name, but instead of that, the person given same answer, good morning, to this different question. Okay, so for first question he given good morning. Okay, so that is a normal thing. Okay, then here the nursing officer asked different question. For this different question also he given same answer, that is good morning. Okay, once you see the definition, what is that? Persistent repetition of words or particular response, or repetition of particular response such as word, phrases, gestures to the different questions, that you can call the perseveration, right? Okay, so let's see the third example. Okay, so here also conversation is going between mental health officer and depressed client. Here third question, here the officer said that, what the officer said, wish you a happy new year. As a normal person, what person should give the reply? Thank you, wish you the same. But but again he repeated the same answer which he has given for the first question and second question. Nothing but here the different questions are there, but the patient given same answer for that question. So this symptom we can call, what is that? Perseveration. abnormal form of thought. Nothing but he can't change his thought. He can't change from one thought to another thought. Okay, so this symptom you can call perseveration symptom. Okay, and finally this is about the perseveration, and finally I give you final touch regarding this perseveration. And if the person repeating his response again and again for different questions, or if the person giving same answers for different questions, that you can call perseveration. Why? Because the person can't change from one thought to another thought. And mainly we can see this symptom in the people who has the Alzheimer's disease, schizophrenia, Parkinson's disease and aphasia, or if the person affected by brain injury. Okay, so in these conditions we can see this symptom. Okay, thank you all.